of individuals will die of heart disease and stroke. And you could say, okay, well, that's our UK problem, but actually when you look globally, it doesn't look very different. That may surprise you. And the reason for this is that cardiovascular disease is increasing in prevalence in the emerging countries around the world, particularly India and China, where it is now the most common cause of heart disease. It's not infectious communicable diseases, it is cardiovascular disease which is causing the problem. I quite like this. This reminds me of Seattle. And the problem is you don't wear your risk on your chest. The risk is difficult to determine. And I think what we'll try and talk to you about in the next few slides is the ways by which we try and do that, to try and understand what the risk is. One of the ways that doctors use this is from the British National Formulary. In the back of the formulary, doctors are probably quite familiar with this, and what this shows is the risk of developing cardiovascular disease in the next 10 years. And I think it's important to recognise this. That's the issue that we're looking at, trying to measure. It's within the next 10 years, and what you see here, these red bits represent high risk, greater than 20% risk. The green bit, obviously, is less than 10% risk. And that risk is calculated using these rather nice and simple diagrams. And what you can see are some of the risk factors associated with that risk. So, first of all, this is in non-diabetic males. If you've got diabetes, your risk is significantly high, and therefore it's not worth actually calculating what that risk is in absolute terms. You require treatment.